you all know that healthcare has been one of the biggest issues in elections, not just presidential elections, but really at many levels of government, including state, for a while. Not just this election, but back through Obamacare, all that. It is a big issue. It was somewhat overwhelmed in this election by COVID, but frankly, COVID is obviously a health issue too. So do we have the right overall structure and emphasis in healthcare in the United States of America? My next guest thinks not. Dr. Reagan Anderson is a practicing Mohs surgeon, M-O-H-S, and I'll let the doc explain that in a second because I had to look it up. It's pretty cool. He's a former 1st Reconnaissance Battalion surgeon. He's a professor. He has a master's degree in public health, and he's the author of Universal Death Care, a solution for healthcare in the age of entitlement. So, Doc, good morning. Thanks so much for being here. And just tell folks before we get into all the issues, what service were you in, and what's your rank, or what was your rank if you're out now?
Well, first of all, thank you for having me. And I was the 1st Reconnaissance Battalion surgeon, which means I was a Navy physician serving a very specialized battalion of Marines, did 2 tours of duty in Iraq, and I am out of the service now. I left as a lieutenant commander, which is the equivalent of a major in the other services.
And just so you know, both my parents are or were, when they were still working, career U.S. Navy medical doctors.
Absolutely. I saw that on your bio. It's awesome to be a Navy brat. I was an Air Force brat. So it's a good tradition to be from. So,
and then what's Mohs surgery? Am I pronouncing that right? M-O-H-S?
You got it. So it was named after Frederick Mohs, who was a pioneer in the dermatology community, and he found a way to remove skin cancers with conserving as much tissue as possible while having cure rates of 97 to 99%. And then after you remove those skin cancers, particularly off of areas like the face, then we reconstruct the area like a plastic surgeon would so that you can have your cosmetic appearance back, or if it's on a hand or other areas, the functional ability back in that area. So it's a great technique. It's in office. You don't have to go under general anesthesia, and we enjoy the highest cure rates of any cancer specialty out there, which is amazing.
Wow. And by the way, you're in Colorado, aren't you?
Colorado Springs, just to your south.
Yeah. At the risk of offering free advertising, what's your dermatology clinic called?
It's Colorado Dermatology Institute. But there's a ton of great dermatologists all across the state, and anybody would be taken well care of at any of them.
Excellent. So let's talk about Universal Death Care. First of all, why that title, and then we can talk about the subtitle.
Sure. I think it's disingenuous to call our healthcare system healthcare, because if you ask any physician out there, we got little to no education on prevention. And if all we are taught is how to treat disease and death, then I don't think that we're purveyors of healthcare. We're purveyors of disease and death care, which, by the way, is enormously profitable. There's a lot of money in cutting cancers off of people, and there's hardly any money in telling people to eat their peas and their carrots and to exercise and to take care of their mental well-being. And while that is not up to the doctor to make sure that happens, that's up to the patient to make sure it happens. When physicians and nurse practitioners and physician assistants and all the other healthcare professionals out there are never taught any of these basics of prevention, I don't think it's really accurate to call us healthcare providers.
Do you think that the lack of emphasis on prevention is financially driven, as you mentioned, or do you think it's just based on this is how medical training has been for 100 years, and it's just sort of a continuation of inside the box thinking just because we're doing it how it's always been done, or some combination of the two?
Oh, it's always a combination. All of these problems and all of the solutions are always nuanced, which is why Congress has such a hard time coming up with common sense solutions because they're often too interested in the easy, simple answer. But the easy, simple answer is hardly ever the answer. So, yes, medical schools have focused on disease, and it's multifactorial. One is the finances of it. The other is it's enormously hard to get people to live healthfully. So in America, between 50 and 85% of all healthcare dollars that are spent treating diseases that could have been prevented had people just taken care of themselves, done what they're supposed to do. And Americans aren't interested in that. We're interested in having the get-rich-quick scheme of medical care or of health, which is I can do whatever I want to my body for as long as I want, and then when I go to the doctor, they should give me a pill, and that should reverse decades of poor health choices. Mm-hmm. Now, there's freedom in America, and I was and am willing to die for this great country, but in America, we impose our freedoms on others to their detriment. So let me explain that. People decide to smoke and to not live healthful lives. And those poor choices, those add up over time. And then when you get older, we all know that you have more healthcare needs because those poor health choices and simply aging starts to catch up with you. Well, once you turn 65, now you get your health care off of the government's dime. Mm-hmm. So all of those poor health choices are now enormously expensive. And it's on the government to fix them or to treat them. And that's why Medicare is set to expire in 2026. It's an enormous problem. And what Washington and the government always does is it looks to the doctor to say, fix everything. The patient comes in and the get-rich-quick scheme of medicine of here's a pill to reverse decades of damage, we are not able to do that. That's magic. That's unicorn thinking. Mm-hmm. It's why I sent my book to Polis and Primavera and told them anything I can do to help you get common sense solutions in Colorado to help our citizens, call me. I've yet to be called. But it's free. And I am not sure when that call is going to be placed, but I'm ready to help. And I hope that everybody here listening to this is saying, well, what do I need to do?
Well, I want to extend this actually to the subtitle of your book now. And for those just joining, my special guest, Dr. Reagan Anderson, a dermatologist and Mohs surgeon in Colorado Springs and former 1st Reconnaissance Battalion surgeon for the U.S. Navy. So the title of your book, Universal Death Care, and then I don't know whether you call it the subtitle or the rest of the title, but A Solution for Healthcare in the Age of Entitlement. And you talked a little bit, properly so, about how we don't get good solutions out of Congress. And I think that most of the reason for that is that Congress isn't actually interested in a solution. They're interested in politics. And they don't, I mean, yeah, there are a few doctors in the House and Senate, but that's not their purpose. And when you note in your title, in an age of entitlement, there's, I think, now look, I'm a screaming libertarian, Doc, but I think,
Understood.
I think there is no way that you get to a good solution. I think a good solution to healthcare is impossible in an age of entitlement and an age where you've got more and more Democrats in particular, but a few Republicans, starting to call what they call healthcare a right. And as soon as you start having government saying everyone gets everything for free, you are no longer on a path where it is even theoretically possible to get to a good outcome. That's my take.
I 100% agree. Because, listen, our relationship with the government, it is a relationship. There's two sides to it. And any time a relationship is one-sided, it's not going to be a healthy relationship. So if the government is trying to give everything to everybody for free and continue to hold doctors and healthcare professionals responsible for all of the outcomes, it's not going to happen. It's not that easy. And it's also not that easy on the libertarian side, by the way, where everything is up to the individual and government should have as little role as possible. Because what happens is corporate greed and just all the abuses that are happening right now continue to happen. We need some guidelines. We need individuals to take responsibility for their own health. It is a both-and solution. Let me give you one example. So the pharmaceutical industry says that as long as, big pharma doesn't increase their prices by more than 10% a year, those are legitimate increases. And so you are in the finance world. So if you're increasing 10% every year and it's compounding, basically, you double the price in 7 years or 8 years. And that includes generics, that includes branded, that includes all drugs. Well, we also know that the majority of cost to bring a drug to market comes when you're developing it in the initial years.
Right.
Once you've made millions and millions and millions, the cost goes down and down and down. So why is pharma thinking it's okay to go above inflation and to double the prices every 7 years? It's absolute insanity.
Yeah, and just
so
for the record, as a libertarian, I only slightly object to pharma wanting to do that as businesses. What I really object to is anything and everything that government does to prevent competition against those pharmaceutical companies, to have the discipline of markets force the costs of those drugs down. It should be so much easier to get generics into the market. It should be absolutely illegal for a pharma company with a patented drug to enter into any kind of financial relationship with a generic drug company for the purpose of preventing the generic drug to go onto the market. Almost nothing else I can think of at the moment works like this. And so I don't blame the pharmaceutical companies for wanting to maximize their profits. I blame government regulations for preventing competition.
And I would agree with you, but I think it's too one-sided again. I think it's a both and. So when you need something to live, a medication, a prescription to live, that puts it in a slightly different marketplace than wanting to buy a new Range Rover because you want to look cool. A slightly different marketplace. And I think that for things that are essential for life, water.
Like insulin.
Insulin, exactly. There ought to be limits. But, generics have gone sky high. It used to be that a prescription of doxycycline, an antibiotic, when I first started out in 2010, it was $5 or $10. Now it's over $120 for the generic. So the generic companies have figured this out as well. And we need to have appropriate limits in place so that people can get their health care needs met. But we also need to have limits on individuals who are destroying their bodies and asking for society to pick up the tab. Again, Medicare is set to go bankrupt in 2026, and that is a number that's been stable for years.
So what do you mean by limits on individuals? Are you talking about actual laws with penalties under the force of law, or penalties that or allow an insurance company to charge you more if you smoke, or what do you mean?
Right. So we all pay FICA taxes that pays for Medicare in the future. I believe that people who are living healthfully should still pay that tax. People who are living unhealthfully, deliberately unhealthfully, they ought to have those taxes increase proportionately to how much they will cost the system in the future for their choices. It's a carrot and a stick. So if you're going to live healthfully, fine, you have a lower premium. If you're not, it raises. It's the only way to get people to have some sort of penalty for their actions. The biggest thing that started limiting tobacco in younger people were not all the ads, were not all the you should do this and you should do that. Everybody knows smoking's bad for you. It was raising the prices of tobacco so that people started to say, wow, I could buy a new car with the money I'm spending smoking these cancer sticks. So we need to find a way that we can educate people, starting from elementary school through all school, including medical school, on how to live healthfully, so that they actually know. And that can't be sponsored by industry, and that can't be, disingenuously taught for corporate greed. It needs to be taught accurately. And then we need to hold people accountable. Right now, our healthcare system is kind of analogous to driving down the road. You're going 30 miles an hour in a 30-mile-an-hour zone, and a car comes speeding by you at 80 miles an hour. And then 3 weeks later, you get the bill for that other person going 80 miles an hour. That's how healthcare is right now, and it's destroying the system.
There is a certain analog to that in, for example, automobile insurance, right? If you have been in an accident or more than one, or you get a DUI, or you got multiple speeding tickets, your price for your automobile insurance is going to be higher than it was before because you present a bigger risk. Just as a somewhat fun but somewhat macabre thought experiment, I have read several studies, although not very recently, about how smokers in particular are a net savings to taxpayers because they die so much younger. And yes, they require a lot of healthcare treatment, like through Medicare when they first get there, but then they die 10 years earlier than other people. And folks have actually done the actuarial studies and said that smoking is a net winner to taxpayers because they die younger, and also they don't collect their Social Security. How's that for a slightly sick thought experiment?
It's slightly sick. I'm not sure it includes all costs associated with those behaviors, but
I'm not either.
Argument, I'll agree with you that it's slightly sick. But here's the thing, right? The ACA, the Affordable Care Act, Obamacare, if you will, that's under attack again in the Supreme Court. And if that were to go away, people with pre-existing conditions would not be able to get health care unless it's on the government dime later on in life. But I think that the pre-existing condition thing was a very good thing that the ACA put into effect, because prior to that, people, who had heart disease or who had diabetes or one of these things, they just couldn't get affordable insurance. Mm-hmm. However, I think it was partially incorrect, too, and short-sighted in that it didn't ask people to prevent the things that they could prevent, and instead said, well, if you have diabetes because you're 300 pounds overweight, that's a pre-existing condition, and, it's not really your fault, and everybody else should pay that bill. It's not appropriate.
Yeah.
The other problem with what's going on with the ACA right now is typical politics. It's not about making the system better. It's about the Republicans trying to get their ounce of flesh by completely throwing the baby out with the bathwater. There are some very good things that happened with the ACA and some things that need to be changed. Leadership is about making things better, not trying to even the score and do something that is horribly bad for the country. In 2016, McCain gave the old emperor's thumb down to throwing out the ACA, one of the deciding votes in the Senate. And he didn't do that because he thought the ACA was great.
No, he did it because he didn't like Donald Trump.
Well, no, he did. Well, I'll leave that. As a former doctor who served in Iraq, I will leave my opinion of what Trump said about McCain off this radio. But, he did it because there was no plan to replace it with something that could work. It was just going to leave this huge vacuum. And McCain knew that partisan power plays were not as important as the health of this great country. I hear,
and we're just about out of time here, Doc. I don't want to interrupt, but I'm actually over time a little bit. I will say it is ridiculous that after all of these years, with so many smart people like you and many others willing to offer opinions and advice, it's ridiculous that Republicans don't have a good replacement plan available for the world to see. I think that's outrageous that they don't. And the other thing I wanted to mention is on pre-existing conditions, there should not be immediate coverage of pre-existing conditions when someone gets health insurance. You've got to encourage people to buy into the pool before they're sick. And I think, and this is going to sound a little crazy, but I think the right model is pet insurance. I just bought pet insurance for my dog, and it doesn't cover pre-existing conditions for 2 weeks. For 2 weeks. Right. And for people, I'd go longer than 2 weeks, 3 months maybe. So, you can't just buy when you're sick and then throw your costs on everyone else, because that's not insurance. That's just making someone else pay your bills, right? So, but if it excludes pre-existing conditions for a short enough period that people buy into the plan earlier, but then I think maybe you find a spot where everybody can live with it. But I don't see politicians going down that road either. I'll give you the last 30 seconds.
Last 30 seconds is Governor Polis. I'm waiting for your call. Any other person out there who's making policy I'm waiting. I have common sense solutions for you. And for everybody listening who's not in a place of power politically, you are in a place of power with your own life. The best way to stop the COVID virus is to be healthy. End of story.
Well, I'll tell you what, any fairly brief, specific message that you want to get to Jared Polis, you email it to me, and I'll get it directly to him.
Thank you, sir.
Dr. Reagan Anderson's new book, Universal Death Care, A Solution for Healthcare in the Age of Entitlement. Thanks for your time, thanks for the book, and thanks for serving our country.
Thank you, sir.
We'll be right back on The Ross Kaminsky Show.